Hello, 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 and welcome to another episode of Crush Cravings Before Diabetes Crushes You. I'm your host, Karen Sammer. I'm a National Board Certified Health and Wellness Coach, and I help people who are overweight and pre-diabetic to crush the cravings that keep them from being able to lose the weight they need to lose so that they can avoid a lifetime of medication for diabetes or other chronic conditions. So today, I'd like to talk to you about weight shaming. So today's title is Beyond the Scale: Weight Shaming and Its Costs. So I'm sure you have seen, there's plenty of jokes on television. There's plenty of self-deprecating humor around people's weight. There's plenty of not self-deprecating humor, but humor at the expense of other people because of weight. And seems to be it's the only acceptable bias anymore. Any other racism, sexism, ageism, ableism, all of those things, while they still exist in huge quantities, they're not acceptable any longer. They're not socially acceptable, and they're frowned upon. But it seems that weight is open. It's fodder for all kinds of things: bigotry, denial of benefits, certain benefits, being overlooked for things, denial of employment, all kinds of things. So we're going to talk about what this actually means. So weight shaming is the act of criticizing, mocking, or stigmatizing individuals based on their body weight or size. And, that can come out in various ways. It can be overt or covert. If it's overt, people just flat out tell you that you're too big for something, or in medical situations that your weight is the only reason that you're unhealthy, and until you lose weight, nothing else is going to change. Or you are dismissed, you are not given certain privileges that are allocated to people who are of more average size. And so those are the overt ways. The covert ways are just the ways people look at you. There are, I had an experience once when I was seeing a doctor, and I had gained, I don't know, from one visit to the next, I had gained enough weight that it was, probably over 10 pounds. And the mere expression on her face when she saw that number made it so that I was so uncomfortable I never went back there. And couple that with other conversations that she and I had about patients that she had who had gained weight, and she had a negative, not overtly saying anything negative about them, but the way she couched her discussion was clear that she did not think that people should be overweight. And in the meantime, she was rail thin. And so she doesn't understand what it feels like to be overweight necessarily, and the struggles that go along with that. But she has no sympathy, and she's a medical professional, somebody with whom you are at your most vulnerable sometimes, and should be able to trust that person to have your best interest at heart. And when you feel like you are being judged or shamed because of a condition that you may or may not have any control over, I mean, that is serious. And that's really, there is a lot of medical bias around people who are overweight. And they are not given the services that they necessarily need as regularly as somebody who is of what would be considered normal weight or average weight. They are dismissed because they are overweight, and therefore they don't care for themselves. Why should this medical professional care for them? And which is all untrue. I mean, these are all kind of biases that are built into people. But also the, insurance denial. Insurance is life insurance is affected. Like your ability to get life insurance or the amount of premiums that you pay for life insurance are affected by the weight of your body. And yes, there is no question that an overweight condition or obese condition can contribute to certain illnesses that you may or may not have, or you may be at risk for, and your risk is increased because of the size of your body. So let that be understood, that while being overweight is a medical condition, that does not, to me, it does not give the doctor the license to decide that you are not worthy of care. You absolutely are worthy of care. So let's talk a little bit more about what is the way in which these prejudices come out. How many times have people been told, if you lost a little weight, such and such could be better, whatever that might be. But I'm only concerned for you. I'm only concerned for your health. I'm only concerned for your well-being. But it's still a form of shaming. The person is very, very aware that their body is of a larger size. They don't need to be reminded by people that their body is of a larger size. What they need is unconditional support. You know, if they try for the millionth time to lose weight, and you kind of roll your eyes and say, well, here we go again. They're at it again, whatever that is. The judgment is coming through. And even if you don't say, are you trying that again, or something as overt as that, it's still clear that you're judging them for what you might consider a lack of self-control, a lack of discipline, a lack of consistency, whatever that may be. But there are other underlying reasons why somebody might be overweight that you may have no knowledge of. And quite honestly, maybe the individual doesn't have any knowledge of. There could be a medical condition that's causing them to hold on to weight. There could be a medication that they're on that causes them to hold on to weight. There could be a mental health issue that causes them to hold on to weight. There are all sorts of reasons why people are overweight. And one of the main reasons is our standard American diet. And when you're led to believe that certain foods are healthy when they clearly are not, clearly to people who are trained and understand this stuff, but not necessarily clearly to the people who are eating the foods that I'm talking about, the processed foods and the refined carbohydrates and the chemical laden packaged foods. People who are overweight and overworked are very often likely to, and not just overweight people, anybody. It just happens to be that overweight people might be more negatively affected by it. But you're going to go for the convenience foods because it's the best way you can get food on the table quickly and just not have to take on one more full-time job. So, you know, doing this day after day is going to have an impact on your body. But the fact that the food system is against us and the medical system is potentially against us, you know, they're not overall, but there are certain medical professionals who have a very significant weight bias. Or, you know, the mental health system is inadequate for helping people to overcome their mental health issues so that they can then overcome their physical issues. So it is really, it's important that we look at this for what it is. It's a bias. There's a medical bias, there's a social bias, there's an employment bias. People who are overweight or obese are less likely to get a job, regardless of their qualifications. If they are running against somebody who is of what would be considered normal body size, with all other qualifications being equal, and even if they are more qualified, very often they will be overlooked in favor of the person who is a different size. And so they very often will be underemployed. And so what is it that causes us to be so weight biased? Well, a lot of it has to do with the media. We are conditioned, we are indoctrinated from a very early age to hold ourselves to an ideal that is not even realistic. If you look in print media, very often the models that you see in the print media, you know, they look perfect and flawless and absolutely well proportioned, and everything about them is without flaw. That very often has been significantly photoshopped, and the proportions, if you were actually to look at the individual versus what the picture looks like, they look nothing like it. Their proportions are not what their body is reflecting. The flawlessness of their skin is not what their body is actually reflecting. They take out all of the blemishes, all of the imperfections, and you have this perfectly sculpted model, I guess. It's sculpture. I would call it a sculpture. It's not even. It is no longer a human because you've altered it so much with Photoshop or whatever the software is that they use to alter photographs of these models. So when you compare yourself to that unrealistic ideal, you're never gonna measure up. You're always gonna fall short. And when we constantly do that, we can not only do we compare ourselves, but we compare other people to that ideal. And when they don't measure up, then we have something to say about that. You know, society has something to say about that. Society shames these people. So what does that lead to? It leads to mental illness. It leads to eating disorders. It leads to hyper focus on your food and your exercise, and just an unhealthy obsession with keeping your body at a certain size. Or the flip side of that coin is that you just know you can't live up to that expectation. So you say, oh, what the hell? I'll do whatever I want and let the chips fall where they may. Well, I think that both of those are unhealthy. And what we actually should strive for is something in the middle, which is what I work with with my clients. What I do is I try to help them to find that middle ground where they can live a life in a reasonably sized body and live healthy without relying on medication as much as they possibly can avoid it. And just helping them to identify the foods that are going to give them the most bang for their buck, and the lifestyle changes that are going to help them the most without completely upending their lives. And that's really what we have to do. We have to find that sort of medium ground where we can live a life among humans without obsessing over every little bite that goes into our mouth or every little move that goes on that our body goes through. And we need to learn also to be kinder to ourselves and to other people who are living in a body that's bigger than what would be considered healthy or normal. So what does that mean? That means that what we want to do, I think that we need to push back on some of the media representations. I mean, I've seen a little bit more in some of the clothing ads. I've seen larger size models modeling the larger size clothes, as opposed to putting a size nothing model in clothing that they also have the same size in larger size women. But you can't, a larger size woman can't see herself there. And I'm just speaking as a woman because I'm a woman, but I'm sure men have the same issue. So making sure that, we are vocal about getting full representation in the media. And there is nothing more cowardly than a keyboard cowboy. Somebody who gets behind a keyboard and fat shames or weight shames or just any kind of shame somebody who is putting themselves out there on whether it's whatever social media platform they're doing. As long as if they're putting themselves out there and they are being vulnerable and they're allowing you to see inside of their life, then if you have an opinion that's negative about that, keep it to yourself. Don't be a keyboard cowboy, a cowardly keyboard cowboy. If you got something to say to somebody, say it to their face. Don't be an anonymous troll sitting in somebody's basement typing out nasty messages. But not only do we want to make sure that we let the media know that this is no longer acceptable, and we try to be kind in our comments to people when they are putting themselves out there, but also not accepting a medical professional's bias against you. And quite honestly, if you've gone through life with a larger body, you become very sensitive or sensitized to those reactions. But often you feel like you don't have the voice to say something about it to them. And I encourage you to find that voice, because where that doctor came from, there's others behind them who would be more sensitive to your situation. I know someone who had bariatric surgery, and I believe, I have not done that, but I believe that you do have to go for follow-up. And there's an expectation on that doctor's part, I guess, the bariatrician, the person who did the surgery. There's an expectation, I guess, that you will lose weight systematically throughout the time that you are with them. But it doesn't often happen, or it doesn't always happen. And very often those surgeries are failures because you can alter the body, you can mutilate a portion of the body, but it still does not change the brain. And the brain is what's causing this, very often is causing the overweight condition. It's it's your dopamine sensors, it's all of the brain chemistry that goes along with being a person who has an unhealthy relationship with food in either direction. So when this person went back to the bariatrician, the bariatrician was, I wouldn't say disappointed, I would say more like condescending about the person's lack of progress in the weight loss department. So they never went back. to that berry nutrition. So they gained all the weight back and more. The surgery was a miserable failure, and they've mutilated part of their body because of the perceived solution to their problem, which it may have been had they had a doctor who was more understanding and sympathetic and supportive than some condescending a-hole who thinks that you should be making progress more than you were, but having no understanding of the circumstances of your life and whatever's going on between your ears. There's always more to it than just calories in, calories out. Always more to it. That's the manifestation of all the other stuff that causes you to eat. All of the noise in your head, all of the circumstances in your life, all of the mental gymnastics that you're going through, all of the things. Everything that goes on in your life, your career, your family, your relationship with your spouse, or your lack of spouse, or you're not having a spouse, or you have a spouse that you no longer want to have a spouse, or whatever it is. There are so many different circumstances that contribute to the situation that you find yourself in. It's not you just eat too much and you're a glutton. That's rarely the case. I mean, we all do stuff that is unhealthy for us in one way or another. I don't think there's a person on this planet who doesn't engage in some sort of unhealthy behaviors. But when it comes to weight, for whatever reason, that seems to be an acceptable punching bag for people.
Let's go back, let's go way on, way back when. I didn't even know you couldn't have been too much more than 10. I ain't no psychiatrist, I ain't no doctor with degrees, but it don't take too much time to see what you're doing to me. You better think about what you're trying to do to me, yeah. Think, let your mind go, let yourself be free. Oh, freedom, freedom, freedom.
When we do weight shame people, we cause the words get in there and they hurt and they stay. They stay in there and they cause all kinds of. They can cause depression and anxiety, and they're going to do more harm than good. Even if you come at them from a perspective of I'm worried about your health. Don't worry about their health. You can support them in a life that makes it a little bit easier for them to see the value of their body at a healthier weight, to see their value in the world and how much more value they can bring when they feel well and healthy and energized in their body, and support them in that endeavor. But telling somebody you should probably lose some weight, they already know that. And they don't want to hear it from you. I can tell you that. They do not want to hear it from you. But there are so many different other things that come along with this weight bias that we have. There is the psychological effect on the human being that is constantly being barraged with this weight bias. There's also the physical effect, because when you are constantly barraged with the message that you're not good enough because you are overweight, it could lead to disordered eating, unhealthy exercise, or avoiding exercise because you don't want to be seen moving your unhealthy, what you would perceive as your unhealthy body, your overweight body. Sometimes people who are overweight are hesitant to go to a gym or go join an exercise class. I personally admire somebody who is, because it is very difficult when you're overweight and haven't exercised for a while to start. And once you start, it's painful. It's painful to move your body. It's painful on your joints. It's painful in your muscles. It's painful. But the fact that you are able to work through that and then get to a point where it's fulfilling and it feels good and you're starting to see the benefits of the exercise. But that takes courage and commitment and the ability to just muscle through when you're not feeling it, when you're feeling insecure about your body, you're feeling insecure about how are people looking at me, are they judging me? If you can be tunnel vision and not even care, because quite honestly, those aren't the people that are going to pay your medical bills. They aren't going to be the ones that are going to pay your salary. They're also not going to be the ones that are going to that are going to be part of your life necessarily. So And that, I mean, I'm talking about being in a public place. I'm not talking about being in your family, because that's a whole other dynamic. But just putting yourself out there is so courageous, and I truly admire somebody who's willing to do that. There's also the social impacts. We tend to isolate ourselves if we feel like we don't feel good in our clothing, or we don't feel like we want to go out, or we've gained weight and we don't want people to see that. We isolate ourselves. It causes problems in relationships, because if we feel badly about ourselves, we're probably not reflecting our best self to the person that we're in a relationship with. It has an economic effect, because very often, as I said before, people who are overweight are denied employment, or given lower jobs, lower paying jobs, or paid lower for the same job, because there is some perception they are not as worthy as somebody who is of a different weight. And then there's also the health outcomes of being fat shamed. It causes stress. Stress causes inflammation. Inflammation can cause you to hold on to weight. So it is a cyclical thing. The more ashamed you are of your weight, the more at risk you are of gaining more weight. Because if you are ashamed and you are being shamed, and quite honestly, I think we shame ourselves at least as harshly as the public does. At least as harshly. I think we're much harder on ourselves, actually. But there are people who are pretty nasty. I won't deny that. But there are a lot of groups in our society, not just in the U.S., in our society, who have a certain level of privilege. I mean, we've all heard of white privilege, and I agree with that 100%. I was born in white skin, and I will never have the experience of not being in white skin. And I embrace the fact that I have had a privilege because of that. But we're not here to talk about that today. But there's a similar type of privilege for thin people. Thin people are perceived more positively. They are considered more likable. They are, again, more employable. They are more likely to find people who are willing, who want to be in a relationship with them. And there is a lot of sort of invisible privilege that goes along with being thin. Try to fly in a plane as an overweight person. Although I believe the seats have gotten a little bit wider, but it's very difficult for somebody who is even a little bit overweight to fit comfortably in an airline seat. And when you sit down next to somebody who's overweight and you're not overweight, do you kind of cringe thinking that person's going to spill over into your seat? It's very uncomfortable for them. It's much more uncomfortable for them than it is for you. So just be a little bit kind, when you're next to someone who is feeling very self-conscious in their body already. They don't need your judgment on top of that. So what we want to do, I think, in order to kind of help to combat this issue, is that we want to promote body diversity in this society. We want to see people of all sizes. Now, that is not to say that everybody should go out and become overweight just for body positivity purposes, because the body positivity movement, while I agree that people should feel good in their own skin regardless of the size of their body, I think that has made it acceptable to be at an unhealthy size. And I'm not an unhealthy size causing problems when you're younger. You may not see the manifestation of that until you get older. But if you carry around an excessive amount of weight for many years, it is going to hurt your joints. It's going to hurt your heart. It's going to cause digestive issues. It's going to cause other organ difficulties. It is also putting you at higher risk for cancer and for heart disease and diabetes, all of these things. So I'm not suggesting that being overweight does not have its ramifications, because it absolutely does. That is the reason that I do what I do, is I help people get into a weight range that is going to keep them from developing a chronic illness like diabetes. But we want to be out there telling people that it is not okay to judge somebody based on the size of their body. We should expect to see people on stages of larger bodies. You don't see overweight women on stages very often. It's rare that you see somebody, or if she's overweight, she's not much overweight. But when you see somebody who's a larger body on a stage, she's likely a comedian who is making fun of her size. And so what we need to do is normalize anybody being anything that they want, regardless of the size of their body. We also want to make sure that we have anti-discrimination laws around overweight. We have them against racism, against sexism, against ageism. Whether they're effective or not is a topic for a different day. But there should be policies around weight discrimination. We also need to encourage our healthcare. We need education in the healthcare system about the treatment of people at a higher weight. There should be healthcare for everybody, and don't assume that when somebody walks into your office and they're 100 pounds overweight that's the reason that they're sick. It may contribute to other issues, but do a thorough examination to make sure that is, if that is indeed the case. Work with them with empathy and compassion and help them to understand what they need to do, because very often people don't know. There's a lot of confusing information out there. We also want to encourage people to have to love themselves and not judge themselves, because as I said before, we are much harsher judges of ourselves than I think anybody else is. So accepting your body, whatever size that may be for the moment, accept it, love it, be kind to it, be compassionate about yourself. And it will help you in your efforts to, if losing weight is your goal, it will help you in your efforts to lose weight, because you know you're worth it. Everybody's worth it. And then we also want to educate people about the stigma around weight bias and how unacceptable that is. People need to know that it is not okay to make fun of somebody because they're overweight. It is not okay. It isn't funny. It's hurtful. It has deep psychological impact. It causes people to be ostracized socially, whether it's through their own efforts, or they isolate themselves, or they've been ostracized from a social group because they don't fit a certain mold. So we need to do better about stuff like that. So there are a lot of pieces to weight discrimination and weight bias, and we need to understand that it's just like any other ism. It's like racism, it's sexism, it's ageism, it's all of the things, ableism, all of those biases that we carry around, and we treat people differently because they fall into one of those categories. That is not acceptable. We all should be treated equitably, not necessarily equally, but equitably. Equitably means that we all have the same shot, the same chance. We should all be starting from the same chance. Nobody should be starting from behind because of something that they have no control over. And with that, I'm going to say, as always, I'd like to offer you a free consultation with me, where we talk about where you are, we talk about where you want to be in your weight journey, and we set up some steps to get you there. If working with me sounds like that dream come true, that's great. Then I'll tell you about that. If not, at least you'll have some action steps to walk away with so that you can get started on your healthy path. If you are overweight and you want to stay that way, that's great. There are things you can do to stay healthy. If you are overweight and you'd like to lose weight, that's great too. I'm there to help you. I'm there to help you with whatever you need. My goal is to help people to avoid diabetes, to get over the cravings that are keeping them from losing the weight if they want to lose, or keeping them from eating a healthy diet, so that they can eliminate the risk, or at least minimize their risk, of developing a chronic illness like diabetes. So go to my website, yourpoweryourhealth.com/book, and book your free consultation. And I look forward to talking to you. Have a great day. Bye.